Hello, everyone, and welcome to today's session. I hope you all can hear me. And this is going to be a very interesting session because something today, what I'm going to talk to you about is a very common thing, and I'm sure a lot of you guys might be suffering from this problem. And today, I'm going to talk to you about headache. So, what exactly is headache and what it has to do with common symptoms? I mean, this is the third most common problem for people who complain of pain. So, when they talk about pain, headache is one of the most common symptoms that they have. And it is expected that about 70% of people at some point of time in their life do complain of headache. Hi, Himanshu. How are you doing? Hope you can hear me. So, we are talking about headaches today, which is a very common thing when we talk about pain. After back pain and knee pain, headache is one of the most common thing that people tend to complain about and have issues with. As discussed, about 45 to 70% of people at some point of time in their life do complain of headaches, and the reason for these kind of things could be varied. Now, headache has different types. You can classify these headaches into primary and secondary. The reason for me to take up this session on headaches is the relevance and the importance of spinal manipulation that comes across in the treatment process that we have seen over the years, and we have seen patients getting better who have been complaining of constant headache or chronic headaches, and they're getting better with this. So that's the reason I'm reflecting on this particular topic. So talking about the two different types of headache, first is a primary one and the second one is a secondary one. Well, primary headache is the cause for 90% of the headaches that actually happen to people, and these are essentially not the very dangerous types of headache. Okay, and secondary headaches are something which is definitely something to worry about, and depending upon your assessments and checking out on the red flags, the doctors can actually understand and help you realize if this is a primary kind of headache or it is a secondary kind of headache. Primary kind of headache basically will be classified as a migraine, or it could be also a cluster headache, or it could also be a tension type of a headache, because sometimes just with the situation you start feeling stressed, and that increases pressure in your intracranial vessels, because of which you can get headache. So talking about migraine, what exactly do we see, or what exactly is the problem that happens in migraine? Well, you tend to have one sided headache. You can also have photophobia, which is a lot of sensitivity to light. You suddenly start reacting very badly to light, or you don't like the presence of too much of light on your eyes. So that probably increases your symptom or your pain to an extent. So this is the kind of sensitivity, or this is the kind of symptoms you see in migraines. Besides that, tension or stress type of headache can actually give you a overall heaviness in the head. Sometimes you also get something called a cluster type of headache, which gives you a pain in the face and the neck area. Most of the time, the cause of these pain is basically stress or tension to the muscles or the vessels, which is intracranial, which is within the brain. So brain as such doesn't have any pain reflex, or it doesn't complain about pain, but it comes through the vessels of the neck and the face muscles. Okay, so this is where you will actually complain of pain in this area, or you will complain of pain in this area, though the source of pain may be something else. You also have one more type of headache which we talk about is cluster type of headache, where you have pain around the face and the neck area. This is again a very common, and there are different symptoms. Sometimes this headache may last for 5 minutes to 2 hours or 3 hours. And these are all classified into primary kind of headaches. These are all kind of the not so dangerous type of headaches. Okay, talking about some of the dangerous type of headaches, or the secondary kind of headaches. So secondary kind of headaches is basically happens because of bleeding in the brain, or if there is a tumor, or if there are reasons where you have a sudden rupture of the artery, or probably a hemorrhage, because of which you can actually witness a lot of headache followed by vomiting. So these are different areas where you will have secondary kind of headache, where spinal manipulation doesn't have a role. This is something something where it is more like an emergency situation, and it needs to be addressed as soon as possible. So these are basically secondary kind of headache which we talk about. Also, talking about the pathophysiology, or what exactly happens in these headache, what exactly causes these headaches to happen. So if we talk about primary types, mostly it is always the stress in the within the vessels of the brain, or sometimes it is also the superficial nerves that causes too much of tension and stress, because of which you tend to get these headaches. So primarily these are the symptoms which you will see in primary kind of headaches. Secondary, as I told you, there could be tumors, there could be a lot of artery rupture, or probably even a vessel rupture, or a vascular issue within your brain vessels, which can actually lead to this kind of headache. So, talking about what do we exactly do when we get a headache, we normally tend to pop a painkiller, or probably follow it up with some sort of steroids, or which are modified into different kind of tablets, which you may even not be knowing that your doctor is prescribing you. And let me tell you, most of these medicines, like aspirin, Disprin, or ibuprofen, these are actually banned in other countries, but we still follow it up, and we still use these kind of drugs just for these kind of headaches. So ideally, this is not the right kind of solution that we look when we talk about headaches. So it's also very important to understand that what can be the right kind of treatment that can work out, when we talk about at least dealing with primary headache. I'm not talking about secondary headaches here. I'm not talking about the reasoning, or probably the relationship, or the treatment that secondary headaches can give you. But yes, primary headache, spinal manipulation, and a lot of other levels of physiotherapy can definitely do wonders, because we have been seeing a lot of patients who have come up with severe cervical spondylitis, which also causes a lot of headache issues, TMJ issues, which is temporomandibular joint problems, which can also lead to a trigeminal neuralgia kind of headache, or it can also lead to occipital neuralgia kind of headache. So these are some of the conditions that we have seen. And when we have started treating patients with spinal manipulation, especially at the atlas axis level, or in fact at the cervical level, followed by some sort of soft tissue release, because the muscles are tight, the facial muscles are very tight, the muscles around the neck, which are like ribbon, a lot of muscles around the neck area, which you have more than 30 to 40 muscles just in this area of the neck that you have. So a lot of tension in these muscles, once they are released, it definitely happens to relieve this whole process. You can certainly put in your questions. I am getting some queries regarding questions, so you can certainly put in your question in the question section, and I'll be more than happy to answer at the end of the session. So these are the kind of therapies that we do. But yes, spinal manipulations, or tissue releases, or even dry needling a lot of times has shown wonders to our patients. And I think it's a very good way of dealing with it. Ultimately, headache should be handled with proper lifestyle change, a long term therapy, which can be spinal manipulation or things like that, which is not again causing a side effect, because a lot of these painkillers, or a lot of these drugs that you use definitely do cause side effects, and it just doesn't clear up your symptoms, but rather modifies your symptoms to a great extent. And the reason, and that's why you tend to have more heavy medicines, or heavy dosages of these medicines. So basically it only modifies the whole issue. A lot of the solution here lies in moving up the neck area, releasing the tension that is required, and spinal manipulation definitely plays a role in this. Let me just acknowledge all the people who have been a part of this session as of now. Hi Himanshu, Salian, Prabhakar, Sanchit Ameni, Manish, Vishal Patil, Dhyavan, Pelli 9, Madhushri Bhaiya, and Chugs0440. Thank you all for joining in. If you're watching us on Instagram, or you're watching us on YouTube, we conduct these sessions where we take up a topic related to the normal problems that we have, whether it is related to joint pain, or some of the most common symptoms that we normally suffer from, and what role does physiotherapy or spinal manipulation has to play in these kind of situations. So we basically talk about these conditions. And one more announcement, of course, is tomorrow we are having a session at House of Cure from 10 a.m. onwards. And if you would like to meet me up for joint pain or any other related issues, or for that matter even headaches, because as I told you that headache this spinal manipulation does have a strong role to play when it comes to chronic or acute headache, and it definitely gives very good results. So yes, you could look out for me. This is the number which I would like to put up in the section: 85756 00040. You can fix an appointment here. I will put up this number. It is 85756 00040. So I have pinned this comment. You can actually check it, and you can call us on this number, and you can take a appointment for this. And this was the session for headache, where I have discussed about the kind of headaches that we have, the kind of problems that we witness, what is the difference between a primary and a secondary headache, which you would rather call a dangerous kind of headache, and something which is more of a physiological or not so serious kind of headache. What do we normally do in these headaches, and what can be an ideal way to treat these headache with treating the cause and not just the symptoms. So this is the session about headaches. Thank you so much for watching in. Vaibhav Raje, Bodycraft, Cherry Goel, Chugs, Madhushri Bhaiya, Dayavan, Vishal Patil, Manish, Sancheti. Thank you everyone for joining in. Thank you so much, and looking forward to see you in the next session. Thank you.